I used to do a lot of traveling, and I'm glad that I did when I had the opportunity. And one of my first trips, I was in the Dominican, and on the second day I got really badly sick with a lung infection, and we believe it was caused from dirty air conditioning. And so I was there for 10 days, and this kit would have definitely been a godsend, I tell you that much, because it was just not a great trip being sick for that long with a respiratory infection. And of course, no doctors that you'd be able to see, right? So, and then there's always the language barrier. So having this kit on hand is definitely an asset. I recommend it if you can afford it, especially if you're going to be planning to be in predicaments such as going camping, for a considerable amount of time and or traveling. What happens if you can't see your doctor? What happens if you can't get into the hospital and you suddenly become ill with pneumonia? You'll recall that I was really sick for about 6 weeks with pneumonia, and I definitely could have used some antibiotics for sure, because initially the first time my antibiotics weren't strong enough. So yeah, this thing could have came in handy. Most definitely. What happens if shit hits the fan and there's no hospital to go to? So in the case, there are 5 different types of antibiotics. They come in like this: azithromycin, prescribed by a doctor, and then your emergency antibiotic guide here as well. So in the kit, we have amoxicillin, used to treat bite wounds, pneumonia, or sinusitis. Azithromycin, used to treat pneumonia, traveler's diarrhea. So also if you are a traveler, well, if you can get out of the country, traveler's diarrhea, urinary tract infection. And ciprofloxacin, let's try that again. Ciprofloxacin, used to treat anthrax exposure and infection, which would be a bioterrorist incident, plague exposure and infection, traveler's diarrhea, and tularemia, bioterrorism. Doxycycline, used to treat anthrax, bites, plague, skin infection, tetanus, tularemia. Fluconazole, which is used to treat metronidazole. These words are tough. Used to treat bacterial vaginosis, diarrhea caused by Giardia, and Clostridoides difficile, giardiasis, tetanus, and trichomoniasis. I'm not a doctor. It tells you what to use by what condition you have: anthrax, bacterial vaginosis, bites, on and on, nausea, vomiting. So, depending on your condition, you know which one of these antibiotics to take. And I know a lot of people don't like to take antibiotics, but this could save your life. What happens if you are out in the bush and were bitten by some sort of an animal and you didn't have access to going to the doctor or to emergency or calling 911, right? So, excellent kit to have, and all of it prescribed by a legit physician. And so this kit is available for the United States and for Canada. And the guide also shows you different cautions, expiration, pregnancy and breastfeeding warnings, and some notes for each one. And great to have this little booklet also. And they all have expiries. This one is for June of 2023. So what I'm actually going to do with these is I'm going to vacuum seal them, similar to what I do when prepping other meds for longer term storage. And I should mention that there is a considerable amount of room still in the bag. Other things that I would put in here would be like aspirin, any of your other medications that you may want to add. Definitely put some Benadryl in there just in case anyone gets stung, because we had a recent emergency with our little pug Scarlet, which will be coming up in another video. And yeah, so there's room in here to add more stuff, even if you want to turn it into a mini first aid kit. Also, it's got a considerable amount of room. And for this, I will not be keeping this in the car all the time because it gets too hot, and so you want it basically in a dark, dry area where the temperature is not crazy hot. So the antibiotics now will keep for a longer period of time, probably for an extra 2 to 3 years. And when I got sick the first time, I did have old antibiotics that I used, and they were just too old. And then, yeah, so I did not have them vacuum sealed. So it's important to get them vacuum sealed up for longer term. So yeah, lots of room in here. Stock it up, do the stuff. I will be keeping this on hand right by our door. So when we do go on excursions, this will be coming with us, along with our emergency bag and other preparedness items. And yeah, a great case. So if you're interested in one of these Jase Medical Cases, I will drop a link to my affiliate link into the description of the video, and I will also pin it into the comments as well. So you can go and check out the site, and then if you decide this is for you, then all you have to do is go and fill out their questionnaire online, and then a physician will be in contact with you just to ask you a few questions. So this is my review on the Jase case. I think it's an excellent product, and definitely if you're going to be doing traveling and outdoor stuff and just even have it in your preps, I think it might be a wise idea. I know not everyone can afford it, but if you can, the link is there. Thank you for watching, everyone. Take care. And I'd like to personally thank Jase Medical and Joy over there. I've been in discussion with her on a number of occasions. She's asking me where my video has been, and ran into some difficulties while mom passing and stuff, and we've been busy here doing things, and then I accidentally somehow fried my laptop charging port or the cable. So it's been fun trying to create this video, and my service here is super slow to upload anything off of my phone to YouTube, and then I have to download and edit stuff. So here it is, Joy, finally got it done. Thank you so much. Take care.